When placing the electrodes for a 12-lead ECG, the form limb electrodes go on first. The red and yellow electrodes are visible here. The chest electrodes are then applied as follows. V1. This lead goes on the fourth intercostal space on the right edge of the sternum. V2. This lead goes on the fourth intercostal space on the left edge of the sternum. V4 goes on next and should be placed on the point intersecting the fifth intercostal space and the midclavicular line. V3 goes on between V2 and V4. V6 goes on next and is placed on the spot intersecting the mid-auxiliary line at the level of V4. V5 goes on between V4 and V6. In this manner, the 6 chest leads give 2 septal views, V1 and V2, 1 anterior septal view, V3, and 2 left lateral views, V5 and V6, of the heart.